Thank you, Natalie. Good morning. Distinguished guests, ladies and gentlemen, all the friends of Richmond Hospital and all the friends of Richmond. Isn't today an exciting day? All the hard work Linda, John, and myself have been working on, talking to Minister Terry Lake and talking to our colleagues, finally bears fruit. But today is just the first step. It's so great to be here today. And I would like to take this opportunity to thank all the guests from Vancouver Coastal Health, Richmond Hospital Foundation, and the community of Richmond for joining us. But first, I would like to acknowledge that we are today making the announcement on the traditional territory of the Musqueam Indian Band. Richmond Hospital has been an important part of our community for over 50 years. It has provided expert care to everyone who walks through this door and walk through the emergency unit door, keeping our community healthy and safe. This concept plan that we are announcing today for a new Acute Care Tower is the first step in determining the future needs of Richmond Hospital and how we can ensure that it continues to meet the needs of patients moving forward. Government, Vancouver Coastal Health, and the Richmond Hospital Foundation are excited, I'm sure of you are excited about this opportunity to redevelop Richmond Hospital in a manner that reflects future needs. While this concept plan is only the first step in the process, it does demonstrate the government's commitment to protecting and renewing our infrastructure. The concept plan will look at the needs of the community and define the scope and budget for a new acute care tower. The plan will focus on current and expected demand and how we can best meet services moving forward, including planning for inpatient beds and seismic standards. We are planning for improvements at the local level, like here in Richmond Hospital. But at the same time, we are also looking at the bigger picture, making improvement to the system as a whole. The ministry's setting priority for the BC health system and accompanying policy focus our efforts on remodeling the healthcare system to address the needs of today and into the future. The strategy acknowledges what makes BC healthcare system one of the best, and also identifies where we can improve to better meet the needs of the population in both the short and long term. One of our focuses is on primary and community care. We need to improve care for people, especially those who are vulnerable, such as the frail elderly, so that it helps manage their health more proactively before they really get sick and end up in hospital. Mind you, I really understand how tough it is for elderly people living in our community because I have two elderly parents in their 90s, and I'm fortunate enough to be right now living with them. They can still quite independent, but when you get elderly people as members of a family, you know how tough it is, and that's why we need hospitals such as Richmond Hospital that can look after their needs. Planning to replace Richmond Hospital's acute care tower will move us closer to a new era of care with updated technology and an environment built with an eye on the future of healthcare. The ministry is also undertaking a review of all Lower Mainland facilities to determine how they can all work together as a system to provide better care for patients. I would like to take this opportunity to recognize and thank the Richmond Hospital Foundation and all their donors for the significant contribution you make to the hospital and community. Your donations and hard work make this possible. Together, between 2001 and 2015, government and regional partners have provided about $94 million in capital funding to improve care at Richmond Hospital. That includes the $6.5 million birth center, which opened in 2009, featuring 15 private maternity care rooms, a 6-bed neonatal intensive care unit, and a maternity-specific operating room and recovery area. Over $10 million to upgrade the emergency department, ambulatory surgical services, and sterile processing department, all completed by 2012. And the beautiful $2 million Milan Ulrich Pavilion that we have the pleasure of enjoying today is served as a hub for information and services that includes a new admitting desk, a dedicated family and patient center, and a simpler signage to help patients find their way through the facility more easily. It's clear that the hospital is close to the hearts of many. And I think it's important to recognize the heart of this hospital, the many healthcare workers who come in every day giving everything to make this hospital what it is and touching so many lives along the way. Rejuvenating this facility will give these professionals the means to continue to provide top-notch care. Thank you for your time here, and we are looking forward to the completion of the new Acute Tower in the years ahead. Thank you.